moment to show some appreciation to healthcare staff this National Nurses Week. We're live at the Nurses Museum in downtown LA as they walk us through a day in their lives.
At this point.
It is National Nurses Week, and today we are celebrating men and women dedicating their time to a healthier world.
KCAL News reporter Tina Patel is live in downtown LA at the only nurse museum in Southern California. Tina.
Yes, good morning. We are inside Dignity Health California Hospital. It used to be a school of nursing, so they actually have a little museum dedicated to it. And Irene and Mario are with me. They're both nurses here. And because we're in the museum, we actually decided to put Irene in one of these old outfits that nurses used to wear back in the day. How does it feel? It feels a little strange to you, doesn't it?
It does. I'm glad that things have changed because this is not my style.
Mario, I'm not going to age you, but you were actually saying when you look around here, it kind of brings up the memories of when you first started in nursing.
Yes, I'll tell you the truth. I did graduate in 1980, so things have changed a lot.
But when you look around, we have some video of kind of all of the different artifacts and things. I mean, some of it's the uniforms, but some of it's the instruments that we were using. I mean, we've come a long way, right?
Oh, yes, definitely, especially with the disposable needles that we were using metal needles before. Now it's so helpful for the patients because sometimes they don't even feel when we give them the shots.
But really, the basis of what you do as a nurse hasn't changed in all those years. You actually said you were in the military before you came to the hospital setting, but what you're doing is really just helping people, right?
Well, yes, that majority of the nurses might say it's helping people. It's not only that, but it's providing them, giving them impact, how we take care of them, and providing the utmost quality of care for them. And one of my main principles in helping patients is putting empathy in my main principles. It's seeing myself as that patient, so I'll be able to provide a safe quality care for them.
And Irene has been doing this for 3 years now. You worked in the hospital beforehand, so you kind of knew what you were getting into. What is it that you love about nursing?
It's just meaningful work. Whether, we're bedside or behind the scenes, we can all make an impact one way or another. And there's endless possibilities. So anybody interested in being nursing? Yes, yes, yes.
Well, that's what you were saying. When you talk to people, you're like, there are so many things, whether you want to work in the ER or the ICU or you want to work with babies, like
Exactly.
there's a career path no matter what you kind of are drawn to.
Exactly.
And tell me, are you glad that you don't have to wear this? Are scrubs better and more comfortable?
Scrubs are better and more comfortable, yes.
Yeah, I was going to say, I mean, I don't necessarily think I would make a good nurse, but I certainly would love it if I could just wear scrubs every day. Also because I spill a lot. So the darker colors, that works for me better than these white uniforms, right?
Definitely, and it's so comfortable. You can actually do your job and not being careful on what you wear.
Yeah, that's one of the best parts about how nursing has changed over the years. As we said, it's National Nurses Week, so if you are around anyone who is a nurse, please thank them for us because they do just amazing work. And the least that they can get is be comfortable, right?
Yes,
we'll send it back to you.
Thank you to both of them and to all the nurses out there. They do so much, and they truly are life-changing. Tina, thank you. The time right now, 7:39.